Good evening and a really warm welcome to our webinar showcasing some excellent nurse projects supported unpaid carers. We are also hoping to shine a light on how the RCN Nursing Awards can help you showcase your nursing brilliance. So my name's Elaine Cole and I work for RCNI on these awards, and it's fair to say that we are passionate about giving nurses a platform to showcase what they do for people, to improve people's lives, sometimes even whole communities' lives. And tonight we're going to, I'm very excited, we're going to hear from two of our award winners in our Commitment to Carers category, which we hope are going to inspire you in your practice. First, we will hear from Jen Kenwood, Patient Experience Lead at NHS England, who sponsors this award, and she will be talking to you about why this award is so important. Next up is our 2020 winner, Kerry Lyons, who is the Admiral nurse for Bolton, and she's going to present to you her unique model of supporting the carers of the unpaid carers of people with dementia in hospital and in various places in the community. Our third speaker is our 2017 winner, Jodie Deers. She won her award for supporting the unpaid carers, the loved ones of inpatients in her hospital. She is now the East of England Carers Lead for NHS England, and as well as talking about her work, the work for which she won the award, she's going to be talking about her latest project supporting young carers. At the end, we have plenty of time for questions. Thank you to everybody who has already submitted questions. It's not too late. You can post your questions in the Q&A box and we will come to those at the end. Finally, we really would like to encourage more people to share the work that they are doing through these awards, so colleagues can learn from them, and in the end, even more people will benefit. So please feel free to ask any questions about our speakers' experience of the awards process, and also about the awards itself. Many nurses we know that they have something valuable to share. Every year, hundreds of nurses, they start their entry and then for some reason they hesitate. So we want to demystify the process. We want to show you how supportive it is, because the most important thing is that we share our practice so others can learn from it. So let's kick off with our first speaker, Jen Kenwood. Jen, over to you.
Thanks, Elaine, and good evening, everyone. It's really nice to be joining you. So I'm going to say a little bit about why this award matters so much, I think from a personal and a professional perspective. And I think it's probably worth saying from the start that as well as my day job at NHS England, leading the programme for unpaid carers, I'm also a carer myself. So I initially cared for my father, who had vascular dementia, who died just about 10 years ago now. I then became a carer for my mum, who has what she describes as a pick and mix of old ladies' issues. And I'm also a carer for my daughter, who has a complex mental health condition, as well as autistic spectrum disorder. So my caring role affects my life every day. And I think to put it in perspective, if you think about the country as a whole, our national census last time round, so 10 years ago now, we've all just completed a new one, suggested that 10% of our population had unpaid caring responsibilities. But actually, when you look at our GP patient survey, which is the largest patient survey we run in this country, around 17 to 20% of respondents, so 1 in 5 people responding to that survey, said they had caring responsibilities. So it's a significant proportion of our population. I think the other really important thing to know from our GP patient survey is that carers experience significantly poorer health than their non-carer peers. They're more likely to experience isolation and loneliness. They're more likely to have issues with raised blood pressure, diabetes, respiratory conditions, musculoskeletal injuries, just to name a few. So it's absolutely vital that we think about this cohort of people as a really significant population that require our support, our kindness, our compassion, our understanding, so that we can support them to continue caring if that's what they choose to do, but more importantly, to live their lives and absolutely thrive as we would want absolutely any other member of our population to do too. I also want to just raise the awareness that we have a lot of, as I've said already, I'm a carer and I'm part of the NHS workforce. We have a huge number of carers within our own workforce. Previously, the Carers Trust had thought, Carers UK rather, had thought that 1 in 5 people working in the NHS were likely to be unpaid carers as well. Actually, our most recent staff survey said that was 1 in 3. So a third of our colleagues will have unpaid caring responsibilities. And if you think about the year that we've all just had, with people working under extremely trying conditions, if you add in additional caring responsibilities at home, that's quite a lot to think about and take on board. So really important that we think not just about the patients that come through the door and sit in clinics or in hospital beds or come through the A&E door, but absolutely about how our friends and colleagues at work might be coping too with their caring responsibilities. This award is relevant to every single area of nursing. So if you're working in an acute setting, in the community, in primary care, in mental health, if you're a healthcare assistant, a midwife, a nurse, you can apply and share your work around support for carers. We've had teams who've won before, we've had individuals who've won before, and I think that the golden thread that runs through all of the applications that we've had that have come to the final is that people have really identified the importance of actually understanding who carers are, what they might experience, and what some of the small and simple changes you can make might do in terms of making those people feel recognised, respected, included and valued as partners in care. It's a real opportunity to shine a spotlight on nurses at all levels as leaders. You don't have to be in charge of a unit to go for this award. What you have to do is have a really good idea about how your actions and your practice can impact and make changes for a really vulnerable group of people. So it's a real opportunity to shine your leadership light and show just how much you can achieve. I've mentioned already the impact of COVID, and I think it's important to think not just about the impact on the people that I've just mentioned in terms of our staff, but we've also seen a really significant rise in the number of people who've taken on caring responsibilities. We've got a really uncertain future for a lot of people as we've started to hear about long COVID and the issues that have gone on around access to facilities, access to diagnostics, access to support systems that people would have previously had. So the impact on carers has been massive, and we have a huge new number of carers as well who may not have expected or foreseen this in any way, shape or form. I've already mentioned some of the inequalities that carers have experienced in terms of their own health, and COVID has absolutely magnified that. And actually, when we drill down some of the data we have within the GP patient survey and look at some of the protected characteristic groups, we can see that that's even magnified even further. So there's really something that has to be done. The old equalities argument of we want to, we need to, we have to absolutely applies in the context of carers. And there's a real benefit to this work. So there's a benefit to patients because it builds their trust and confidence if they see you respecting and including the people that really matter to them. There is an absolute benefit to carers in terms of them feeling included, respected and having their own health and well-being considered. There's a benefit to our services because actually if we get things right early, recognise people early, provide the support that they need early, we build capacity and are able to respond more effectively to the needs of the carers, the people they care for, and actually our wider patient communities as well. And we've also over time seen a real benefit to the winners of this award, in fact the finalists of this award. And I was reflecting with Elaine when we had a meeting last week about our first ever year when we ran this award. And our winner was in a temporary post that then became permanent and was expanded to cover more than one trust. The other finalists, we had someone who was an entrepreneur who was running a service for people with eating disorders and looking at how you could support the families of those people. And she was commissioned by her CCG to expand her service and deliver it more widely. We had a nursing lecturer who was using their skills labs at weekends and engaging student nurses to work with carers and teach skills to carers. And again, they were commissioned by the CCG to actually build and expand that service to help carers care safely for people at home. And we also had another person who was an Admiral nurse who then actually became a nurse consultant as well. So it's been a real benefit to those people in terms of cementing their position within their organisations. We've seen them all progress, we've seen temporary posts become permanent, and we've seen people really moving up the career ladder and being able to shine a light on why this work around carers really matters. So I'm going to finish there because I think the really inspiring bit is about to come when you hear from our previous winners, from Kerry and from Jodie. They are absolutely brilliant, and I think you'll find that you're absolutely brilliant too. So please, as Elaine said, don't hold back from entering this award. Really put your best foot forward and share the amazing work that we do, because we know there are some brilliant leaders amongst you. So thank you so much for joining us, and I look forward to seeing your entries.
Thanks, Jen. Yeah, it is one of the lovely things about these awards, that it's not just the winners that go on to benefit from taking part. We see our finalists enjoy lots of benefits, so thank you for raising that. Next, we're going to hear from our 2020 winner, Kerry Lyons, and I know the judges were very impressed in the way that Kerry had adjusted her services for carers during the pandemic. And yeah, so I'm going to hand over to Kerry now. Thanks, Kerry.
Thank you, Elaine. And yeah, thank you for the opportunity of participating tonight. I was delighted to be the category winner last year, so I'm delighted to have an opportunity to present my model of practice and what I do currently at Bolton. Are we able to share the presentation? Is that fantastic? So my name's Kerry Lyons. I'm an Admiral Dementia Specialist nurse, based at Bolton Hospital, but I cover both the hospital and the community, so cross primary and secondary care. And like I've said, I was delighted to win the Commitment to Carers category last year. I'm therefore going to share with you my award submission, the model of working and how we have supported carers. I am one of only a small number of acute Admiral nurse services. And so a little bit about Bolton Foundation Trust. So we are an integrated care organisation. We didn't want a traditional acute Admiral nurse service. We wanted something quite different. So not traditionally hospital centred. We wanted to create a bespoke service that met the needs of our community. And we did that and achieved excellent outcomes. And the reasons why we submitted our model was that we strongly believed that our way of working was wholly transferable to any other locality and could benefit many more families. So why did we do things differently? Well, the cost of dementia care is increasing and currently stands at £37 billion per year, which roughly equates to £30,000 per person. And sadly, escalating costs don't necessarily mean that our families are always receiving high quality, consistent care. As populations age, so do the numbers further increase of people who are living with dementia. So a little bit about Bolton and a little bit about myself. So my family are from Bolton. My grandfather had mixed dementia, vascular and Alzheimer's dementia, and was cared for by my grandmother, who really struggled as a carer. Bolton is the largest UK town. We have lots of cultural diversity, and currently there are over 3,000 people in Bolton who are living with dementia. With only one Admiral nurse, which was myself, it was about trying to work creatively and looking at a system-wide approach to improving our standards. And as is the national picture, 1 in 4 of our hospital beds are occupied by a person who it has a history of dementia. And unfortunately, research shows us that hospitalisation often results in a higher chance of patient and carer stress, longer periods of inpatient stay, and poorer clinical outcomes. So this is why we developed a model that focused on crisis reduction, averting hospital admission and improving both outcomes and experience, both for the person living with dementia and their family carer. So most people living with and supporting a person with dementia will inform you that good can only ever be achieved from access to tailored holistic support, with care, consideration, inclusion and choice. Good is certainly not falling between the gaps that exist between health and social care. My Bolton families want me to tell you that good, it's seamless, it's high quality care from knowledgeable staff who are aware of the daily challenges faced by a person and family living with dementia. Staff who strive to understand a person's perspective and their lived experience. They also want to say that good is being supported, both emotionally and practically, to feel empowered to understand the condition and be able to plan ahead when supporting the person they love most of all. As an Admiral nurse, I have the absolute privilege of being able to care for the whole family in its widest context. So at Bolton, we've worked very closely with our carers to identify our priorities. We have planned our next steps and we filmed a video that we now feature in every dementia awareness training session. Working with our carers enabled us to identify our key areas for improvement. It also enabled us to include a clear voice to be heard and to be acknowledged of our carers. Due to time constraints for tonight, unfortunately I'm unable to play the video, but have included the link within the slide for you to either screenshot or just, you know, take a note of, and then you can follow that up at a later time. As a trust, we are now strengthening inclusion. We've worked with our carers to develop the iCare project, which has 4 key standards. I care that you see me. I care about my inpatient experience. I care about care involvement, and I care about my onward journey. So early on, we decided that we wanted a different way of working. We created an Admiral nurse post in collaboration with Dementia UK as a hybrid hospital community role. We created seamless tailored pathways for support, so one-to-one and group. That included me supporting our staff as well, who were carers outside of their professional role. We focused on holistic interventions and increased education opportunities for carers and staff. We appointed dementia champions in all our clinical areas. Currently today we have nearly 280 dementia champions within the organisation. We created groups whereby carers were in the driving seat of what the support group would deliver and what it would cover. Together we developed a template whereby we would look at a whole 12 months of what we would cover in terms of education. Ultimately, we wanted to increase the awareness and support option for families living with dementia and our community. So a little bit about Admiral nursing for people who may not know what an Admiral nurse is. So an Admiral nurse focuses on complex families, complex patient, not all people with the diagnosis of dementia, but that doesn't mean that I'm not here for anybody in Bolton. I certainly am. Admiral nurses provide a family and relationship centred approach. We provide specialist assessments and evidence-based interventions. We offer clinical, psychological and social support for families, family carers, people living with dementia. We liaise with professionals and organisations, we educate, we consult and we support changes in practice. We support family and carers in hospital. We provide education to carers and education to hospital staff. We support the hospital to become a more dementia-friendly environment, prevent the management of risks to health and facilitate effective and timely discharge. And an Admiral nurse also carries a caseload of community families. So I never want any of my presentations to be just about the numbers, but as you will see with the next slide, that the numbers are huge. Activity has been huge. I'm very fortunate to work in an organisation whereby it's about quality and experience. That's been our focus, not about the numbers. But in stating that, you know, the numbers did not happen by chance. We have had to have a vision. We've had a mission, we've had a purpose, and we've had the ability to bring people together. As Bolton closely with the wider multidisciplinary team, strengthening the support that they offer to families living with dementia. Within this role, I am able to bridge both hospital and community setting, ensuring that families and people living with dementia have prompt and expert access to support and guidance when they need it. I support people through to and after discharge, strengthening resilience, averting crisis admission, offer ongoing support on both a one-to-one and a group basis. So the next slide shows a falls prevention session in our carer group. On a daily basis, as part of one-to-one support, I cover education from everything from pressure damage to sexuality to sundown and everything in between. The groups offer peer support, they offer practical solutions. It takes one person to create a movement, and in this case the Admiral nurse was that person, but it is the people living with dementia, their carers, their families and the wider teams who have created a sustainable movement for change. We collectively wanted a better Bolton. And if admission occurs, then we now have improved our inpatient environments to improve the experience of care. We enable participation and inclusion with access to overnight stay, carer lanyards, and I am on hand to visit the clinical areas if required to support, either with the person living with dementia or their family carer. And as you will see from the next slide, many staff have now been trained, and not just through traditional training methods, but also through immersive training experience. This training has enabled staff and empowered them to do the right thing more easily, and to step into the shoes of a person living with dementia with a greater understanding of what patients, their carers and families experience as the disease process worsens. So we've engaged in lots of social prescribing. So it's not about pharmacological therapy. Sometimes it can be, but it's got to be about a mix of approaches. And this is just one single example of some of that social prescribing. The slide refers to a music group. We run weekly at our community centres within Bolton. Launched as a collaborative project between the hospital and the local music service. Amidst COVID, we have now delivered these through Zoom very, very effectively, and they're well attended. The group is for people living with dementia at any stage of illness, and for them to attend with their carer as a shared activity for wellbeing. Many of the people who attend the group struggle in social setting. They struggle with word finding and inclusion within the world around them. The group offers joy, it offers well-being, and it offers a safe space that is fully inclusive. So we applied for the RCN Awards as we wanted to raise the profile of our model. Awards platform, they lift your project into a spotlight, and in this respect, following the RCN Award, I became the 2020 Dementia Care Practitioner of the Year. I feel that I share this title with everybody like me who is trying to make a difference within dementia care. There are so many good pockets of good practice out there. As nurses, we need to get better at sharing what we do well. Applying will raise your confidence. It will help others think outside of the box. It gives you a presentation opportunity. It will give you writing opportunities. It will give you collaborative opportunities. I am a great believer in the nurse's ability to steer the way, to think creatively. So in most of my presentations, I always try and include this image. It says, if you change nothing, nothing will change. A play on words, but it demonstrates how we as nurses can be that difference to our patients, to our families and to our NHS. So thank you for the opportunity to speak today. I would encourage anybody to apply for this award.
Thank you so much, Kerry. Thank you so much, Kerry, for your presentation. It's really inspiring, and I think yeah, it blows me away that how holistic your approach is. So thank you. And if anybody has any questions for Kerry, please use the Q&A box, and we will come to them after our next presentation, which will be just as inspiring. Jodie Deers was our 2017 Commitment to Carers Award winner, and she's going to talk to you about her award-winning project and what she's been doing since. So if I can hand over to you, Jodie.
Thanks, Elaine, and thank you for the opportunity to present today. So I won the award in 2017. It was, and this was the time when you could go to the hairdressers and get your hair cut, but not now. So it's been quite a journey, and today's given me a chance to reflect. So I won the award. I was a carers lead in an acute trust, and it was about supporting adults in my hospital. So when I started, it was a seconded role, and I was literally had the remit to go big and support carers. So that was exactly what we did. So we developed a vision, which was to make carers welcome and equal partners in the care when the person they care for come into hospital. So that was the vision that we shared throughout all the conversations, all the meetings, all the training that we had with staff and the carers that came, and the carer organisations as well. So as part of making carers welcome, we revamped the carers policy and ensured that they had the access that they could to the person that they cared for. We opened up visiting hours. So we did it in two ways. Carers who were identified could visit 24 hours a day if it was appropriate. But considering that a lot of carers, so I think in Hertfordshire, it was 100,000 carers were unidentified. It was, how can you benefit from carer support within the acute trust if you actually don't know that you are an unpaid carer? So we opened up our visiting hours alongside the open access for carers. So visiting hours went from a restricted 3 hours a day to a 12-hour period. And that enabled staff to actually have those conversations and develop the relationships with, the family member or the visitor, and actually start to see if they were an unpaid carer and how we could support them better whilst they were visiting. So we introduced carer passports. We purchased carer beds with charity money so that people who were caring could stay overnight with the person that they cared for. We encouraged partnership working. Carers were very much an equal partner in care, and it was what they wanted to do. So it wasn't that carers were expected to participate in care. If they wanted to, they had that option. So, but we would often have carers that would participate in washing, cleaning, feeding the patients, and the overall experience was much, much better. We introduced carer snack bags so that we could provide food and nutrition whilst carers were there, free tea and coffee, discounts to the hospital, restaurant and car parking. So quite developed a really broad range of support for carers. And a part of this identification is that we were supporting carers very well in the acute trust, but in actual fact, we needed to continue that support as they transitioned into the community. So part of the program that we developed was that we also actively referred carers to the community carer organisation. We didn't just give leaflets, because often if you're a carer, you're quite overwhelmed. So we actually, with permission, did the referral on their behalf, and we increased the referral rate from our acute hospital. We also reduced the number of caring years of people who were identified in hospital. So previous to this work, carers that were identified within the hospital had been caring for 7 years and had no access to services. And we were able to reduce that by 2 years, and that was quite significant in a 12-month period. So I applied for the RCNI award. It's one of the only awards that recognises carers, so I think it's a really valuable award. My goal was to be shortlisted, which I was, and it was to raise that profile of the work that had been done in the hospital, because my ultimate goal was to have a substantive post, so that this work wasn't just 12 months worth, it was actually embedded and become business as usual. So from surprisingly, the night was amazing. So it was the most inspirational night of my nursing career. It was amazing, and surprisingly, I won. So it was really good. The platform that winning gives you, I think you don't realise what an impact that will have. It gives you opportunities, you develop networks, there's a lot of relationship building. Jen and the Commitment to Carers team are so supportive, and they'll include you in so many opportunities to have your voice heard, to continue the work that you're doing, and also to raise the profile and share the practice that you've been doing with other areas and other organisations. So the next slide. So after winning the award, it was really, my journey has been about what happened next. So as I said, my job became substantive, and that was a huge, in a trust that was making comebacks. I had the opportunity to also present at the Chief Nursing Summit. I've presented at the Carers Oversight Group. I've presented in other areas that are exemplars for carers support, such as Surrey. I had the opportunity to access some funding, and with that, in co-production and listening to carers, we developed a carers handbook, and that's the little yellow hand picture on the bottom left. And with that, we wanted to improve. So I'd done a lot of work for adult carers and wanted to improve the services for young carers. So they were very much non-existent in the hospital. So I contacted the local young carer organisation, and we talked about developing a format for carers to have information. So the idea was that young carers could access information without having to be relied upon a health professional giving them that information, because most of the time health professionals were missing who were the young carers. So they had done a Dragon's Den, and they had come up with the idea of CareNet, which was an app to support young carers. They had mapped out the whole idea. So with my little bit of funding, I went to the local college and worked with the tech IT department, and we developed a young carers app for Hertfordshire. So based on that work, I then got a grant to do some research, and I'm currently doing some research on young carers and using technology as a method of gaining support and information. It should have been complete, but it's been delayed because of COVID, but that work is still undergoing. And as part of that COVID and the app and the increased awareness, one of people that I've been networking with up in Harrogate, they were developing a more formal young carers app. So I joined that work, and part of the learning from the research and the original app development contributed to the app, again with young carer support. And the third logo, the orange one, is an app that was released in young carers week of Young Carers Action Day just recently, and it's available on Google and Apple Play if you search Young Carer Support App, and it's the information and support there is amazing, and it also links to local care organisations if young carers feel that they need that support. So again, in the acute trust, I think it's the next slide, Rosie, is that I started to develop a more of a young carer program and actively identifying young carers in the acute hospital. So this is work that hasn't been done from anywhere that I can find. So I linked in with our children's safeguarding team and used to meet with them as a multidisciplinary team once a week. They would talk about different cases that came into the hospital, and it would be looking at having a multidisciplinary approach to actually trying to give better support to the young person and their family. And through that meeting, there were so many young carers that were coming up in conversation that nobody had actually ever thought of having a caring role before. So just through education, increasing awareness, we were able to start identifying young carers that were coming into our emergency departments. And also through the Think Family approach, so any parent that came in with either drug, alcohol or domestic abuse, if there was a family, any children in there as well, they were also highlighted and identified as potentially being young carers. So we were able to have conversations with the family, able to support the parents better as well, so through social, mainly through social prescribing, because if you can improve the circumstances of the family and the parents, you will undoubtedly improve the circumstances for the young carer as well. One of the big things that we found through the referrals, so we'd identify the young carers in the acute setting. I would then refer them with permission to the young carer organisation team. And what we found is that literally every young carer that came through and was identified was actually a young carer in crisis. A lot of the reasons they came in is because it was a mental health issue, or their parent had a mental health issue. The needs of those children that we identified were actually much higher compared to any young carer that was identified via the normal routes, which would be the schools or GP surgeries. So in a 3-month period, we identified 20 young carers, did 20 young carer referrals, identified 32 parent carers as well. And I think the really take-home message for this was that they were all new. They weren't known to services, but the conditions that their health needs were such that they were coming into contact with health professionals. They were seeing, they were coming into the hospital, so they were known, but people hadn't inquired enough or didn't have the understanding that these people could be young carers. Building on the young carer work, we had a young carer takeover day. So we had a group of young carers that came in. They went to the children's department, they went to the emergency department, and they went to our outpatients department. And they gave us feedback and suggestions on how we could make those areas much more carer friendly. One of the things was to change the paperwork in our children's admission in the emergency department, because what the young people were telling us was, how do you bring up in a medical assessment that you're a young carer? It's completely out of context, you know, and they didn't feel comfortable bringing that up as well. So now it was one of the questions that was asked. So if that person had a caring responsibility. One of the other pieces of work that we did was to develop carer champions, so that rather than just rely on me and the team I worked with, we would actually have young carer champions throughout the departments, adult emergency and children's emergency, so that we could pick up more and identify more young carers. So again, in co-production, we developed a young carer badge, and that we had a competition winner, and that was developed, it was won by Holly, and Holly was a young carer who I actually identified through the program that that I had instigated. So it was really exciting to know that she was still engaging with services, and that, you know, she became our winner. We developed posters, and we also had a young carer training program, which was 3 hours, and we included the training was completely co-produced. I only had a small part in it. We had parent carers on there that were delivering the training, and we also had the young carer team delivering the training and social prescribing. So that started, I think we only got through about 6 people through, and then of course we went into the 4th or 3rd lockdown, whatever lockdown we've gone through. So it was put on hold, but now that we're actually coming out of COVID in the Acute Trust, they are looking to re-establish the Young Carer Training Program and get that back on track. So I think that was, I mean, I'm really proud of that work in the hospital because, as I said, it's unique. Part of the work with young carers that I've had, so I've had a relationship with some young carers over the years, and one of them, Annie, who's also helped on the research that I've been part of, she wrote a blog, and that was shared with NHS England as part of the Young Carer Action Day. So it was her story, and Annie is such an inspirational young carer, and it just goes to show if you get the right support, how well you can do. I also had the opportunity to shortlist for the 2020 RCN Awards, and saw Kerry's amazing application, so that was really exciting too. And I think finally, the next slide is, I think, is how far the journey can take you. So I started off just trying to get a job as supporting carers, and over the years of all the work that I've done and opportunities, I also then had the chance to apply for a job as the East of England carers lead, and was successful. So January this year, I've started working alongside Jen's team, and that's been really exciting. And again, for me, kind of a full circle. So, you know, I started with this journey winning the award that was supported by the Commitment to Carers team, and now I work alongside them. And this was our photo, so Jen, myself and Kate Garraway, and also just to show that you don't have to be have carers in your job title or job description to actually become to support carers. You know, Kate Garraway has now become a carer, and you know, her husband was the intensive care unit. So I think when we look at supporting carers, anyone can do it in any type of work that we're doing as nurses, and I think that's really important to remember. These awards are open to anybody. If any piece of work that you're doing supports carers in any shape or form, it is really worth applying. So, and I can't thank the RCNI and the Commitment to Carers team enough for my opportunities. Thank you.
Thanks very much, thanks very much, Jodie, for that inspiring presentation, and sort of running through how you're working to identify and support young carers. I know that it's particularly tricky, and they also seem particularly difficult to identify, so thank you. A couple of questions. First of all, I thought we would go to Kerry. Kerry, you mentioned in your presentation that you were using social prescribing to support carers. I wondered if you could explain how you managed to do that, how you approached it.
Yeah, so I think I'm very mindful. I'm an acute nurse by background, and yes, you know, in terms of dementia, I absolutely understand the importance of pharmacological support, and when it's appropriate and when it's not appropriate. And it's about making sure that we look at all options in terms of psychosocial support. So that can be from an educational point of view, or it could be peer-to-peer support, you know, or it could be that we're looking at distraction therapy or counselling or CBT, another range of, and it was about trying to develop a range of options to families. What I never want to, you know, what's very important from an Admiral nurse point of view is that somebody understands that, you know, it's not just about pharma, it's not just about medication, it's about, you know, sometimes even having the right information at the right time, you know, and looking at preventative measures. We do an awful lot around prevention, especially prevention, so that, you know, a family's not going into crisis, you know, and their situation isn't escalating further. And we've done everything really from, I suppose, adopting, you know, music therapy approaches to distraction, to craft, to having one-to-one discussion. You know, I would say that it's tailored for every single person. There are no blueprints in the intervention that you offer as an Admiral nurse. Every person's different, every family's different. And it's about, you know, having those discussions as to, you know, what can help, and also exploring what's available.
Thanks, Kerry. A question on the awards, someone looking for practical advice. Jodie, I wondered if you could help here. Have you got any advice on how to write a good entry, an entry that stands out? How did you go about it?
I think the guidance that goes with the entry is quite good. I put all the questions onto a Word document so that I could have that time to really think about what I had done. The real key, I think, to the award is to have a more, you have to look at the impact of the work that you've done. So really think about the impact and a greater systems approach. So for me, it wasn't just about the work that I'd done in the hospital supporting carers, it was also that transition into the community support as well. So I think you have to look at the work that you're doing, look at the impact within your organisation, and plus how it's affecting carers outside. Because there's a word limit, it is a bit tricky. You've got to be really, really concise, but that's also very good. And I did it with, I had someone give me a hand, so I put most of the content down, and then we kind of narrowed it and streamlined it and did it that way. So probably if you really pushed, you could do it in a day. So so it's not complex, and you don't have to use fancy words. It is just really about the support that you've done that has made the difference to carers.
Thanks, Jodie. This is related, and I'm going to go to Kerry on this. How did you evaluate? I mean, impact is very important, and quite often where some of our entries fail to get the judge's attention is where they haven't actually demonstrated how the impact on carers' experience and lives as carers. So, Kerry, could you talk about how you evaluated your work and how you demonstrated that to the judges?
Yeah, so I suppose I think we were very fortunate that I was a brand new service 2 years ago, and we set out correctly, really, is what I probably want to say, in terms of making sure that you record the numbers, but not just from a quantitative point of view, but from a qualitative point of view as well. You've got to understand the impact that you're making. So every person that was trained, we logged in terms of contacts, the amount of people that were being trained, the the level of champions that we had, but also as well we evaluated their effectiveness. So, you know, every training session we did pre and post evaluations, and it's about trying to pull that information into your award submission, you know, because the numbers are really important, but like I said in the presentation, it's not all about the numbers, and it's also about being able to show that actually it's not just one person, it's system-wide change, you know, and also as well to understand what is the wider impact of the numbers. So, you know, for example, for my service, you know, I'm an acute Admiral nurse, so that's reduction in length of stay, which then creates a better patient experience and a better health experience, you know, and it's about being able to try and demonstrate that. I mean, it is hard when you know, when you submit to these awards, because you haven't got a, you know, you've got a finite amount of word limit, but you have got questions to guide you, but it's about making sure that you've got to understand that that person reading doesn't know anything about you, doesn't know anything about your service, you know, and it's about trying to demonstrate the impact of what you do and why it makes a difference, but also as well the transferability that's really important. You know, that's these awards will give you a platform for being able to share the model as a best practice model, and that's one of the things that I found from applying and then from winning, that we've been contacted by many more organisations who are saying, you know, actually we didn't know what an Admiral nurse was, we didn't know Admiral nurses worked in acute, and we never thought about the outcomes that could be achieved from having one person and then a team drive forward change from all of these approaches, everything from the right support at the right time to admission avoidance to training. So that's been the greatest impact really, but you've got to be able to demonstrate that in your submission or you won't be shortlisted. You know, it's about that, you know, demonstrable evidence, quantitative, qualitative, and being able to be transferable. Can you pick that model up and put it elsewhere, and will it have the same level of impact?
Thanks, Kerry. Jen, I didn't know if you wanted to make any comment about what you're looking for as a judge when you read an entry.
Sure. So I think Kerry and Jodie have been really good with what they've said, and I guess from my perspective, sometimes people make an entry and they have so many ideas that it's quite hard to actually pick out exactly what it is they're talking about in terms of what they've done that's different or innovative. So for me, it's about being really clear and succinct. You don't have to put in every single detail of your project. You just need to be able to say what the overview is, why it matters, why it makes a difference, and what you think the impact is or will be. So it's about being really clear, keeping it simple so there's a really compelling story. And actually, if you get to the shortlist point, as Kerry and Jodie both have done, and get to present in the sort of final stages, you can really expand on that in your presentation. And I'm sure people that were in the room remember Kerry had us all in tears because she included her film with all the carers that she'd worked with. And so she was able to share that qualitative, quantitative side of it, as well as really create a strong story about the process of what she was doing and the scope of it, and absolutely the scalability. You know, certainly from a national perspective, what we want to be able to do is share just the most brilliant practice that someone else can pinch with pride and make happen in their own area. And if it's too complicated, it doesn't happen. So if it's a really good, simple idea, those are the things that stick and make a difference longer term.
Thanks, Jen. I just wanted to pick up on something you explained, that we have 5 finalists shortlisted. Those 5 finalists will be invited to present to our panel of judges. And this year, as last year, we will be doing this by video conferencing and virtually. I just wondered, Kerry, how did you find it?
I found it really good. I was very nervous and I don't think I'm a natural presenter. I'm full of passion, but not a natural presenter, but I found it really good. It was very well organised, and I actually enjoyed the process, which I didn't think I would do really. You know, you have 10 minutes to wow the judges, and I suppose to be able to get your personality over and why this is really important to you. But yeah, it was a good process. I did not feel robbed by not being able to sit in a room with judges. You know, it felt, I maybe felt a little bit robbed that we couldn't go to the awards ceremony. We missed out because of COVID, but yeah, no, it felt absolutely fine. Really well organised. I was given lots of information beforehand. Felt really at ease. You know, Rosie helped with all of the uploading of the presentation, moving the slides on. Yeah, I was absolutely fine.
Thanks, Kerry.
Elaine, can I just add to that, that certainly as a judging panel, what we want to do is see people shine. You know, no one wants, as a judge on the panel, to make people uncomfortable. So I think from a judge's perspective, we want to really encourage people to come and just, you know, share their fabulousness. And I hope that, I mean, it sounds like Kerry's experience was really positive, but what I would hope is that anyone who does go through this process will see that actually the judges are just so excited to hear what you have to say. It is such a privilege to be on that panel. So please don't feel that people sit in a sort of aloof way while you're doing your talking and sharing your work. We're all jumping around in our seats, getting very excited about the brilliant stuff you're presenting. So, you know, it's a very welcoming and warm environment for you to come to.
Thanks, Jen. We're very tight of time now, so thank you, everyone. I think that's all we've got time for. I was just going to finish up with a quick slide. Before this webinar, I've spoken to a number of judges about what are the key things that really make an awards entry stand out. And these were the common themes that they all raised. So first of all, of course, you have to enter, put your work forward so we can celebrate and showcase it. Be proud of what you've done. It's very important that you take credit of what you've done as a nurse, as well as acknowledging the contributions of your team. Make sure impact, we talked about that earlier, you know, describe how your initiative has improved the experience of carers and the people that they care for as well. And evidence, show your evaluation, whether it's the numbers or whether it's the patient feedback. Make sure you include it so, you know, the judges can really see how you have made a difference. So all that's left to say is a huge thank you to Jodie, Kerry and Jen for their time this evening, and thanks for joining us. We look forward to reading all your entries. Good night.